I'm Amy Raschulte, family practice doctor with TriHealth, Western Family Physicians.
My name is Meg Cohn. I am the RN care coordinator here at Western Family Physicians, and I work with our 6 primary care doctors.
I think the transition in our practice has been making it more of a team environment. I've never really had the go-to person like I do with Meg. If I have any issues with social support or ancillary services, which before I just hoped for the best, now I really feel like I'm supported in my patients receiving all that quality care. And I feel like when I'm done seeing the patient, they're not done with our practice. I feel like Meg is kind of following up on loose ends and being sure that the patient's supported.
One of the new functions that we have done is this pre-visit planning, where we've had the opportunity to review the chart prior to the physician coming in. So we're going to know a few days ahead of time that they're coming in, and we're going to know why they're coming in. But then what we do to augment that is we're looking what labs have been accomplished. Have they been to any other service, such as another hospital in town? And through Care Everywhere and also through the Health Bridge, we're able to identify what follow-up or maybe a new medication that has been added. And through the pre-visit planning, we're oftentimes calling the patient ahead of time to reconcile the medications, and we're getting them in as quickly as possible from that ED visit or from perhaps a hospital stay. We then make sure that when they come back in, we're checking to see through the pre-visit planning, we're making sure, through Care Everywhere and the Health Bridge, have they done the tests? Have they done the labs? So that it's really a meaningful interaction when they interact with Dr. Raschulte. My thought is that we're kind of building a roadmap for the physician, because we know that we want to utilize our resources as efficiently as we can. So when the physician comes in, he or she has everything that they need to really drive that care and then interact with the physician so that it can be meaningful.
In addition, as primary care doctors, transitioned to huddles, which was initially a patient-centered medical home tool. But definitely the CPCI has reinforced the idea of getting together with other team members prior to patients coming in. And, if somebody had told me, oh, that's going to be very helpful for you maybe 5 or 6 years ago, I wouldn't have necessarily understood. Now it's tremendous, because you're ready then for, what you think, or anticipating the needs of the patients before they come in. And I think that makes a difference. When somebody sees you come in the office and already kind of aware of their needs, it makes a big difference. So the question has been posed as, why is a personal relationship important with a primary care doctor and their patient? And I feel like the patient feels more cared for. The patient's probably more open to being honest. We can break down barriers more easily when they feel cared for that way. I think I get better buy-in from patients, more motivated and more accountable, especially if they know we're following up. It used to be before I didn't have all the support to say, have you called me with your blood sugars? Have you called me with your blood pressures? Now I have multiple people on our team all giving the same message, all being sure that the patient has kind of done their part.
The importance of what the physician does is the diagnosing and the treating and knowing that it's of the highest level, and then our goal is to come around and kind of augment those services and wrap around whatever's necessary. I think of the patient and the physician as kind of the center of a wheel. They're kind of at the hub, and then we've got all these outside services that are kind of the spokes. And the goal is, once the physician, the primary care doctor, and the patient have together agreed about what the plan is, then my responsibility is to then connect that plan to all of those outside services. I think one of our main goals is education. Yeah. Because if we can educate someone, then we've given them the power to then go forward to research it more, mm-hmm. to find out, why is this important to me? So we try to tailor it to the educational interests of the patient versus just saying everybody gets a piece of paper. It's like, no, some people are visual, some people, tactile. So I think that's a positive addition to the program.
Yeah, and as a PCP provider, I consider myself like the navigator. I'm going to help
Absolutely.
you. I'm going to help your ship be, more easily sailing, I guess.
Right.
To me, it's my responsibility. If they're not having an issue with a specialist or they're not having access to care, that's my responsibility to help them achieve that. I think another advantage to both the patient and employers is cost containment with regard to healthcare. I mean, that's a huge issue. And I feel like in our practice, because we have better access to care, we've made adjustments being a CBCI site so that we have acute visits available. So instead of probably 5 years ago saying, okay, go to the ER, now it's come into the office, we'll get things adjusted here. We have the help of an RN, we have the help of giving insulin here.
Absolutely.
All of those are opportunities we can do to keep the patient out of the hospital, out of the emergency department, even out of urgent care.
Right. And we know the patient. When they come into our office, it's a familiar location. They know their doctor. They know someone like myself that's a care manager. And it's like, okay, we don't have to start at ground zero and work our way up.
So I think an added bonus that we've achieved through CPCI support is I have patients come in who aren't necessarily having a medical problem themselves, but are having a lot of issues from caregiver stress because they're taking care of an elderly parent, an aunt, an uncle, and these issues weigh heavily on them and can impact their productivity at work and their overall health status. So being able to support them is to support that family member, especially if we're a family practice, so oftentimes we see multiple generations. And we can intervene and help with the elderly family member, give them support services, point them in the right direction. And that definitely takes a lot of stress away from that caregiver.
We had a patient that was having some medical issues. She was hospitalized in the hospital, but the family really didn't understand a lot about her medical illness. But we really brought the family in, and what we had found out that there was a significant amount of stress because they didn't understand the disease process. So what we did is we formed a really strong bond with the hospital staff. So as soon as she was discharged, she came to us immediately, like within 2 days. The family came in. We were able to provide diabetic education one-on-one, and we were able to bring the family in and really educate them. So her health is significantly improved, and the family is very appreciative because they're working employees and they have families, and so they feel much more comfortable that their mother is in safe hands and doing well with her health. We are looking at each patient individually and trying to understand from their perspective what their needs are. So we're trying to tailor that to their needs. And the goal is that we want everyone to hopefully be at an area where they have the support systems in place. And if we see that someone is sliding or that the situation's becoming more acute, then it's our responsibility to get them back on a path of health promotion and making sure that we're not just focusing on disease management.
We're trying to see all their needs, including social support. Are they getting exercise? Are they eating a healthy diet? Are there severe spiritual needs we could address?
If there are any barriers
to their health, all those things. As a family practice doctor, I was taught, for health promotion and prevention. And so not just disease treatment, which we do, but the goal of getting ahead of the game and hopefully addressing those issues before they become a problem. Yeah, I mean, we really want to optimize their health and optimize and reach for wellness, not just
putting a Band-Aid.